American Cancer Society recently updated cervical cancer screening guidelines.
Here to break it all down for us this morning is Hartford Healthcare's Dr. Masad Azadi with the Cancer Institute of St. Vincent's Medical Center. Doctor, thank you so much for being with you. And let me start out by asking you straight out, what prompted these changes?
Yeah, I think just to explain a little bit, I'm a gynecologic oncologist. I manage all the gynecologic malignancy, including cervical cancer, but the screening mainly done by general gynecologists and primary care. When you look at the cervix is the opening of the womb to the vagina and is not externally visible. And to do a screening, we really need to do a pelvic exam. And if you look at the cervical cancer, almost all of them are basically caused by HPV, human papilloma virus. And the screening for human papilloma virus is very important. And when you look at it, most of the sexually active adults, more than half of them are infected with the human papilloma virus. But luckily, about 90% of them resolve within a couple of years. But minority persists, especially high-risk HPV. When they persist, they incorporate into a cervical cell, and they can cause precancers or dysplasia, and over years, they can become cancer. The goal of screening is to find this precancerous and treat them, that way prevent the cervical cancer, or if you find the cervical cancer early, to be able to cure it. And the screening been very, very good. Screening has been very significant, the cancer significantly. And actually, HPV vaccination is very important. All of us parents should really try to discuss with our pediatrician doing vaccination with our children, boys and girls between 9 and 14 age. But yes, screening has been changed over time. They try to make it more efficient and less bothersome on the woman. And there are several societies that does that, including American Cancer Society and American College of Obstetric Gynecology. For the last 15 years or so, it's been standard to do screening at age 21 with the pap smear, which is obtaining the cell from the cervix. But at age 30, we incorporate HPV. But recently, as you said, American Cancer Society changed the guideline. And they said instead of 21, we can start at 25. The reason for that is that the younger age than 25, they have high rate of HPV infection. As I mentioned, most of these HPV infections, they resolve on their own. And most of the abnormal pap smear in a younger age, they can resolve spontaneously in low-grade changes. And that's why they think that would be better and decrease the screening. But American College of Obstetric Gynecology does not agree with that. And all of the gynecologists, they follow that guideline. We still wanted to do it at age 21 with the screening. And the reason is that the multiple, but I don't want to increase. I want to wait for your questions. Go ahead, please.
Yeah, and this also specifies when a woman can stop cervical screenings. Is that right?
Yes. At all of the American College of Obstetric Gynecology and American Cancer Society, they both agree that in the past and in the new guideline, after age 65, most of women can stop screening for the cervical cancer. But as I said, most, not all. These are for the ladies that have a low risk for cancer, and they have to have 10 years prior the normal smears, normal screening. And if they had a dysplasia or the precancers before, at least 25 years of having a normal screening. And not everybody qualifies for that. That's why I think it needs to be discussion between the patient and the gynecologist based on their past history and a risk factor to decide who really needs to stop screening. But we can't just say all of them, but most of them stop, yes.
Wow. All right. Critical information there for so many. Dr. Azadi with the Cancer Institute, St. Vincent's Medical Center. Thank you so much for your time today. Really important stuff here. Thank you.
Thank you, doctor.
Thank you very much.